All right, so we are back today with the next part of the endocrine system that we have left to cover. We are going to pick up today with the adrenal glands. Okay, so you have two adrenal glands. They would be one on top of each kidney. We have two kidneys, so you would have two adrenal glands if they're on top. Structurally and functionally, your adrenal glands act like two endocrine organs just in one. You have the adrenal cortex and the adrenal medulla. The adrenal cortex is the outer layer, and the adrenal medulla is the inner layer of the adrenal gland. We'll start with the adrenal cortex first. So there's basically three major groups of steroid hormones that your adrenal cortex will produce. Collectively, they're called corticosteroids, and they include mineralocorticoids, glucocorticoids, and sex hormones. So we'll start with the mineralocorticoids. Again, this is produced by the outermost layer of your adrenal cortex, so that outer part of your adrenal gland. It's mainly going to be aldosterone, and it has an important role in regulating the mineral content of your blood, in particular salt. So sodium and potassium ions are going to be regulated by this kind of hormone. The target tissue for mineralocorticoids would be your kidney tubules, because they're going to selectively reabsorb minerals or let those minerals be flushed out of the body in the urine. So when your blood levels of aldosterone rise or they increase, your kidney tubules are going to pull in sodium ions and secrete or get rid of more potassium ions into the urine. When sodium is reabsorbed, water is going to follow the sodium. So it really does help regulate the water balance in your body fluids, as well as the electrolyte balance in your body fluids. There's renin, which is an enzyme produced by your kidneys when your blood pressure falls. That's also going to cause the release of aldosterone by causing kind of a chain of reactions that happen that will form something called angiotensin 2, and then that's going to trigger aldosterone to be released. There's also ANP, which is called atrial natriuretic peptide, and that's released by your heart. That's going to prevent the release of aldosterone, so it's going to actually reduce blood volume and blood pressure, so it works in opposite of that. With glucocorticoids, that's produced by the middle layer of the adrenal cortex, and that's going to be released in response to rising levels of adrenocorticotropic hormone in your blood. It's going to cause natural cell or normal cell metabolism to happen. And it also helps your body resist long-term stressors by increasing your blood glucose levels. And there's cortisone and cortisol that are the hormones included in that. When your glucocorticoid levels are high, fats and proteins typically get broken down and converted into glucose. So because it's converting fat and proteins into glucose, those hormones, cortisone and cortisol, are said to be hyperglycemic hormones, so they're going to increase your blood glucose. They also control the unpleasant effects of inflammation by decreasing edema, which we talked about yesterday. Again, that's swelling and water retention. And they're also going to reduce pain by inhibiting pain-causing molecules called prostaglandins. So due to the fact that glucocorticoids have anti-inflammatory properties, they're usually given as drugs or medication to suppress inflammation, particularly in patients that have rheumatoid arthritis, which is an autoimmune disease where your immune system attacks the joints of your body. And that does cause inflammation, and which is swelling and pain. So those are typically useful in treating that condition. And then next we have sex hormones. The adrenal cortex will produce both male and female sex hormones throughout the life of a person in relatively small amounts. The bulk of sex hormones is actually produced by the innermost layer are androgens, which are male sex hormones. But it does produce some estrogens, which are female sex hormones. They're also formed there. So because there are sex hormones being produced by the adrenal cortex, and males and females have adrenal glands, males still have some levels of estrogen in their body, it's just low, and females have some levels of testosterone in their body, and that's just low. So that's how you get the hormones essentially from the opposite sex. If we look at imbalances with adrenal cortex hormones, first we have Addison's disease, And that is hyposecretion, or not producing enough of all of the adrenal cortex hormones. People with Addison's typically have like a strange bronze tone to their skin. They would have a loss of sodium and water. Their muscles would be weak and their immune system wouldn't function properly. With hypersecretion problems, again, producing too much adrenal cortex hormones, it could actually result from a tumor in the pituitary gland or in the adrenal cortex. So we would have hyperaldosteronism, and that is when the outermost cortical layer of the adrenal gland is hyperactive, causing excessive amounts of water and sodium to be retained. Potassium is lost too much, to such a point that actually the heart and the nervous system activity can be disrupted. Next is Cushing's syndrome, and that's caused by a tumor in the middle of the adrenal cortex, or actually doses of glucocorticoids that are too high can cause that as well. And it results in a swollen, what we call a moon face. The person would have kind of a buffalo hump of fat on their upper back, kind of have like a hunchback there a little bit, high blood pressure, high blood sugar, which is hyperglycemia, which in this case would be steroid-induced diabetes. Their bones would become weak, and their immune system also would be suppressed with that. And then lastly, we have masculinization, so hypersecretion of sex hormones, regardless of if the person is male or female. In adult males, the effects are typically masked because they have higher levels of testosterone anyway, but it can have dramatic results in females, such as developing facial hair, masculine pattern of hair distribution, as well as some other issues. Next, if we move on and look at the adrenal medulla, this actually develops from a knot of nervous tissue similar to the posterior pituitary. When your adrenal medulla is stimulated by the sympathetic nervous system, it's going to release two very similar hormones, which together we call catecholamines, and they would be epinephrine and norepinephrine. So for catecholamines, when you either are or you feel threatened, and it could be physically or emotionally, your sympathetic nervous system causes what we call a fight or flight response. And we talked about that a little bit with the nervous system. What it's going to do is it stimulates the adrenal medulla to kind of pump those hormones, epinephrine and norepinephrine, into the bloodstream, and enhance or prolong the effects of neurotransmitters from your sympathetic nervous system. What these catecholamines are going to do are increase your heart rate, increase blood pressure and blood glucose. It's going to dilate the airways of your lungs so you can get more oxygen into your system. The results, like I just said, would be more oxygen. You have your blood glucose would increase. You would have faster circulation, so you're getting blood as well as glucose and oxygen to the rest of your body quicker. So if you have part or all of the adrenal medulla is damaged or destroyed for some reason, there's really no major long-term effects as long as the person's sympathetic nervous system is functioning normally. But if there's hypersecretion of catecholamines, and this means like long-term, not just during periods of stress, a person would have rapidly beating heart, their blood pressure would be high all the time, they might be irritable, they would perspire. So in order to correct that, they would actually need surgery to remove those cells that are part of the adrenal medulla that would release those catecholamines. Next, we have the pancreas. So there's actually a couple different parts to the pancreas, but what we're going to focus on would be the pancreatic islets. The pancreas is located near your stomach in the abdominal cavity, and it has both an endocrine and an exocrine function, which I mentioned earlier on yesterday. The pancreatic islets are also called the islets of Langerhans, after the person that kind of discovered what they do. This part of the pancreas has an endocrine function, so they're going to produce two hormones, insulin and glucagon. And then in addition to the pancreatic islets, there's also a cinar tissue, which is where the exocrine function of the pancreas is controlled. And that part of the pancreas will produce enzymes to help with digestion. As far as insulin, you have alpha cells and beta cells of the pancreas, and insulin is released by the beta cells. This hormone will act pretty much on every cell in the body, and what it does is it just increases their ability to transport glucose across their membranes through facilitated diffusion. So if you remember way back to when you had bio and learned about facilitated diffusion, we talked about how glucose is able to get into the cell through facilitated diffusion, where it just needs a little bit of a help from a protein to get a larger molecule like glucose into the cell. So glucose needs to go into our cells so we can use it to make energy, or it can also be converted into glycogen or fat for storage long term. When your blood glucose levels drop, that's going to, through negative feedback, end the release of insulin. You cannot get glucose into your cells without that hormone insulin, which people who have diabetes, type 1 or type 2, why they typically have high blood sugar is because they're either not making any insulin, or they're not making enough insulin, or their body is not responding to the insulin that they make. So their blood glucose levels stay high because they don't have that insulin being released to get glucose into their cells so they can make energy. So with insulin, this is when people would have diabetes that we typically think of when we think of diabetes, and it's called diabetes mellitus. So without insulin, your blood glucose is going to rise dramatically. People can have blood sugars of like 600 rather than 100. And that glucose is going to kind of spill into the urine because the kidneys can't reabsorb it fast enough. So one way that you can test for diabetes is by testing urine and checking and seeing if there's glucose in the urine. So as glucose leaves the body, water follows it. So the people with diabetes become dehydrated. Fats and proteins are broken down to use for energy. The person's weight declines because of that. And then loss of proteins decreases the ability to fight infections. So they might have issues with their immune system fighting things off. This is why people with diabetes are at a higher risk of contracting COVID. If you've heard that diabetes is considered a risk factor or a pre-existing condition that would make you more at risk for it. That's why. So when we're using a lot of fats for energy, your blood becomes very acidic, and it's called acidosis. And then ketones, which are produced when protein is metabolized or used, are going to appear in the blood, and that's called ketoacidosis. And that can cause a person to go into a coma, and they can die from that. There's 3 cardinal signs of diabetes. One would be polyuria, which is excessive urination. Your body does that to get rid of the excess glucose and ketones. Polydipsia is excessive thirst, and you would have that because of getting rid of a lot of water in your urine. And then polyphagia is hunger due to the inability to use the sugars that you're intaking and losing fat and protein. So there's 2 types of diabetes mellitus. There's type 1 and type 2 that we're going to talk about. So type 1 diabetes is referred to often as juvenile diabetes because typically people develop this when they are younger. And these people do not typically produce insulin. So they have a pancreas, but their pancreas does not produce any insulin for them at all. So people often have to either take insulin injections at certain times of day, like before they eat, for example, or now there are insulin pumps where there's also continuous glucose monitors where people can have these things that can constantly tell them what their blood sugar is, and they can dose themselves with more or less insulin depending on what their blood sugar would be. For type 2 diabetes, this is considered adult onset diabetes because people usually develop that later in life. There is a genetic component to type 2 diabetes, but not all of the time, but sometimes you can reduce your risk, I'll say, of type 2 diabetes by controlling your diet and exercising. People that are type 2 diabetics produce insulin, but their receptors on their cells are not able to respond to the insulin that they are producing, and that's referred to as insulin resistance. So they can take oral medications to increase the sensitivity of their target tissues to insulin, and follow special diets. Sometimes it's bad enough where they would also need insulin injections in addition to oral medication. The other hormone produced by your pancreas is called glucagon. And this is released, so insulin is released by the beta cells of the islets of Langerhans, and glucagon is released by the alpha cells. This acts as an antagonist to insulin, and it's going to be stimulated by low blood sugar levels. The primary target organ for glucagon would be the liver. It's going to cause the liver to break down glycogen that's been stored into glucose and then release the glucose into the bloodstream. Next, we have the pineal gland. We kind of skipped this a little bit when we did the nervous system. We did mention it, but I said we would come back to it when we got to the endocrine system, and that time has come. So the pineal gland is a small cone-shaped gland that hangs from the roof of the third ventricle in our brains. And the only hormone that it secretes in substantial amounts is melatonin. Melatonin is going to have a sleep trigger, so it plays a role in your circadian rhythms, in your body's regulation of the day and night cycle. The peak levels occur at night, so your levels of melatonin change throughout the day. As it gets darker out, then your body's going to start to release more melatonin. That's why usually people are like more tired and less wanting to do things in the winter, because there's less daylight. So the levels are going to peak at night to make us sleepy, and they'll be the lowest around noon when there's the most sunlight. It's also thought to coordinate the hormones of fertility, and to inhibit the reproductive system until adult body size has been reached. So it's also thought to have a role in that. Next, we have the thymus. Okay, and the thymus is located kind of right above the heart. It's usually larger in infants and children, and then it decreases in size as we age. The hormone that your thymus produces is called thymosin, and it seems like it's essential for the normal development of your white blood cells called our T cells or T lymphocytes. The immune system is something that we will get to later in the year, so we'll talk more about your T cells when we get to the immune system. Next, we have your gonads, or the ovaries and testes. They have both an exocrine and endocrine function. For the exocrine function, your gonads will produce sex cells, which would be either eggs or sperm. And for the endocrine function, they're going to produce sex hormones that are identical to the hormones that your adrenal cortex would make. The major difference between them are basically the location of production and then how much of those hormones that they produce. So if we look first at the ovaries, there's going to be two groups of steroid hormones produced by the ovaries. That would be estrogens and progesterone. Estrogens are responsible for the development of sex characteristics in women. So the growth and maturation of the reproductive organs, the appearance of secondary sex characteristics, like hair growth in the pubic and axillary regions at puberty. Estrogens will also act with progesterone to promote breast development and help regulate and start the menstrual cycle. Progesterone, again, acts with estrogen to bring about the menstrual cycle. And during pregnancy, it's going to have a role on the muscles of the uterus to allow the implanted embryo to remain there. So progesterone helps to essentially stop the menstrual cycle during pregnancy. It also helps to prepare your breast tissue for lactation during pregnancy. If there is hyposecretion of estrogens and or progesterone, it's going to inhibit the ability of a woman to conceive and have children. So it would be possible that a woman might need hormone therapy or hormone replacement therapy to help get her pregnant if she was having hyposecretion of these two sex hormones. Next, if we look at the hormones of the testes, they produce male sex hormones that we refer to as androgens, and testosterone is the most important androgen. It's going to promote growth and maturation of the reproductive system organs at puberty, It will cause the secondary sex characteristics of the male to appear, which would include the growth of facial hair, development of heavier bones and muscles, lowering of the voice. It also stimulates a male's sex drive, and it is necessary in males for sperm production. So if there's not enough production of testosterone, in many cases it can make the man sterile, so he would be unable to have children. But that could be remedied by testosterone injections that would then help him to produce an appropriate amount of sperm in order to have children. Next, we'll talk about the placenta, and this is kind of the last endocrine gland we'll go over. It's just a temporary organ because it is only in the uterus when a woman is pregnant. And it's going to produce both protein and steroid hormones that help to maintain the pregnancy and get the body ready for the baby to be born. So one of the hormones it produces is called human chorionic gonadotropin, or HCG. That's going to stimulate the ovaries to make estrogen and progesterone so that the menstrual cycle is skipped over during pregnancy. The ovaries are actually active until the 3rd month of pregnancy, and then the placenta will take over at that point and produce any estrogen and progesterone that are needed. So that means that the ovaries are inactive for the remainder of the pregnancy after that 3-month point. Next, we have human placental lactogen, or HPL. That's going to work with estrogen and progesterone to help prepare the breast tissue for lactation or for milk production. And then relaxin is going to allow the pelvic ligaments in the woman to, essentially what the hormone says is to relax and become more flexible, which will make the birthing process a little bit easier than it would be without it. And the last two things we have to look at, or last two slides, I should say, just looks at aging in our endocrine system. So most endocrine glands function smoothly until we get to an older age, other than other malfunctions, which we mentioned earlier. In women, there's a process called menopause, which is caused by the decline in efficiency of the ovaries. So reproductive organs will start to atrophy. They are no longer able to have children. They would produce less estrogen and progesterone. They can, having less estrogen can actually cause arteriosclerosis, osteoporosis. Their skin loses its elasticity. They might have hot flashes, be tired, kind of have nervousness, mood swings or changes like depression. Men, on the other hand, have no real dramatic changes like that. And in fact, many men, while women after menopause generally lose the ability to have children, men typically remain fertile throughout their lifespan. So that shows that testosterone is still being produced in adequate enough amounts to allow that to happen. And then other things that happen as we age would be that growth hormone output declines. That kind of explains why our muscles atrophy as we age. Elderly people are less able to resist stress and infection. That can be caused by either overproduction or underproduction of defensive hormones. Things that we've been exposed to throughout our lives, such as chemicals or pollutants, that can diminish our endocrine function, which can also show why certain cancers appear more often in older adults in certain areas of the country because of exposure to those different kinds of chemicals or pesticides. Elderly people are often mildly hypothyroid, so typically you gain weight as you get older. You don't use your food for energy as efficiently. And all older people have a decline in their insulin production. So it typically, people are going to have type 2 diabetes more commonly in that elderly age group. We will be doing a lot more with these hormones and glands, going over things to make it a little easier for you, hopefully, to remember all of them, because I know this is a lot of information. If you have questions, please don't hesitate to let me know.